Good afternoon, my people. Welcome back to our YouTube channel, whereby we always get educational bangers each and every day. And I am starting this video by commenting on those who are appreciating the good job this channel is doing to the community at large. Many of you, many people are appreciating the topics we are discussing, and I have always requested, if you are there and you have given out your topic and it has not yet been discussed, don't be discouraged. Just continue exercising your patience, and in due time it will be discussed. Today we will be looking at how the tests, the tests to determine kidney function, or whether the kidneys are functioning well or normally. So today we'll be looking at how these tests are performed, or how are they done. And before we continue, if you are there and you are watching this video for the first time, just take a second or two, click the subscription button, put the notification bell on, so that whenever I produce a video like this, YouTube will automatically notify you and you will never miss any of our videos. For the returning subscribers, I always appreciate you people for the good work you are doing to this channel. It's all because of your support that this channel is standing at the moment. So let's continue sharing with our brothers and sisters so that it may grow bigger and bigger. How the tests are performed. Kidney function test requires a 24-hour urine sample and blood test. Key point. Kidney function test requires a 24-hour urine sample and blood test. So it's not a one-time thing. It's not something you can go and test like malaria. It requires a 24-hour urine sample and blood tests. Let's look at the 24-hour urine sample. A 24-hour urine sample is a creatinine clearance test. This will determine whether the kidneys are clearing or filtering creatinine accurately. So a 24-hour urine sample is a creatinine clearance test. It gives your doctor an idea of how much creatinine your body expels over a single day. Very important. A 24-hour urine sample is a creatinine clearance test, which gives your doctor an idea of how much creatinine your body expels over a single day. So if you are in a position to determine how much creatinine your body and specifically your kidney expels, because it's the work of the kidneys, by so doing you will be in a position to determine whether the kidneys are working normally or there is a compromise in their work. I hope you are together up to that point. A point to note: on the day that you start the tests, very important, on the day that you start the tests, urinate into the toilet as you normally would when you wake up. Let me repeat this again. On the day that you start the tests, urinate into the toilet as you normally would when you wake up. For the rest of the day and night, urinate into a special container provided by a doctor. Let me repeat this again. On the day that you start the test, urinate into the toilet as you normally would when you wake up. So when you wake up, definitely you go to the toilet and urinate. Just do it as normal. For the rest of the day and night, urinate into a special container provided by your doctor. Keep the container capped and refrigerated during the collection process. You should not leave the container open because this urine might be contaminated. Remember, germs can also be airborne. That's why we are saying for the make sure, and this is very important, make sure you keep the container capped or closed and refrigerated. If you refrigerate this container, there will be no chances of bacterial growth. Keep the container capped and refrigerated during the collection process. Make sure you label the container clearly and tell other family members why it is in the refrigerator. Remember, it might appear funny for your family members, you having a urine container stored in a refrigerator. It may appear weird. That's why we are saying make sure you label the container clearly and tell other family members why it's in the refrigerator, because somebody may just come and find it and decide to throw it away. On the morning of the second day, urinate into the container when you get up. The first day you urinated in the toilet as usual, and the rest of the urine during the day and night into a special container provided by your doctor, which should be kept and stored in a refrigerator. So on the morning of the second day, urinate into the container when you get up. This completes the 24-hour collection process. How is it complete? The first day, when you started the test, you urinated normally in the toilet, the way you usually do when you wake up. Then the rest of the day and night, you urinate in a special container provided by your doctor. On the morning of the second day, urinate into the container when you get up. This completes the 24-hour collection process. Follow your doctor's instruction about where to drop the sample off. Follow your doctor's instructions about where to drop the sample off. You may need to return it either to your doctor's office or laboratory. You may need to return it. This is the container that you have been urinating on or in. You may need to return it either to your doctor's office or laboratory. That was all about the 24-hour urine sample. Let's look at the blood samples. Remember, we are looking at how these tests are performed, or how kidney function tests are performed. We have looked at the 24-hour urine sample, and let's look at blood samples. Blood, urea, nitrogen, and serum tests require blood samples taken in a lab or laboratory or doctor's office. Blood, urea, nitrogen, and serum tests require blood samples taken in a laboratory or doctor's office. The technician drawing the blood ties a plastic band around your arm, making veins stand out. These are the usual procedures we always do when we want to withdraw blood sample from a client. That's why we are saying the technician drawing the blood ties plastic band around your arm, making veins stand out or visible. A technician cleans the area over the vein. Obviously, you have to clean it up with a spirit swab to avoid any contamination, especially by bacteria on the skin. So, technician cleans area over the vein. They slip a hollow needle through your skin into the vein. The technician cleans the area over the vein. They slip a hollow needle through your skin into the vein. Blood will flow into a tube that will be sent for analysis. Blood will flow into a tube that will be sent for analysis. I hope we are together up to that point. You may feel some pain when needle enters your arm, or the client may feel some pain when the needle enters the arm. Definitely there is a nervous supply, so the nerves have to sense that pain. The area around the puncture may develop a bruise over the next few days. However, you should not feel severe or long-term pain. So the pain is short-term. The area around the puncture may develop a bruise over the next few days. However, you should not feel severe or long-term pain. This means the pain should be short-term. It should not stay there for long. After being punctured, after some hours, it should clear. Even if there is a bruise, it should clear in a few hours or few days, and it should not be long term. This marks the end of our video today. Let's continue supporting this channel, and I'm very sure the community will benefit from this. Let's have a wonderful day ahead.